Mutations, variants, spike proteins, our values. Along with the surges of COVID-19 infections, we've been hit by waves of scientific information that most of us are not knowledgeable enough to understand. We watch the news, and sometimes it can appear that each new variant is more contagious and lethal than the last. But a virologist from Columbia University is concerned that misunderstanding variants is causing confusion, panic, and in some cases a reluctance to get vaccinated.
I'm Vincent Racaniello, and you're listening to the podcast all about viruses.
Professor Racaniello has hosted this podcast for many years, but during the pandemic he's been frustrated with what he says is misleading information about the new variants when we still don't know if they pose a unique or substantial risk compared to earlier variants. So this year he and his colleagues wrote an opinion piece in the New York Times which stated that human behaviour is far more important in shaping the course of the pandemic than any variant. What do your peers think of the piece?
For the most part, everyone agrees with me, which makes you wonder, why is the narrative so completely different being, put forward by the mainstream media? So I don't mean to blame the press entirely, because they get their information from scientists.
Since appearing in India in late 2020, the Delta variant has become dominant in most of the world. But Professor Racaniello is concerned people are getting confused, thinking that because it's spreading so quickly, it must also be more infectious or more dangerous. That may not be the case.
They're leaving out the human factor. So what happened in India, they were under lockdown for quite a while, and they didn't have a lot of cases. Then the government decided, we don't need to do this anymore. People went back to gatherings. In fact, there were huge gatherings of millions of people suddenly where there weren't before.
In March, when cases were on the rise in India, millions of devout Hindus came from all over the country and gathered in the Himalayan town of Hardwar to participate in the Kumbh Mela festival. It became a super spreader event.
The apparent spread and domination of a new variant makes many people say, yeah, it must be more transmissible. But it's not. It's simply in the right place at the right time, and it's outcompeting the former variant. It's a little bit more fit. So Delta is, so far, the fittest of all of them.
There are a few things to explain here. You would have heard people talking about how transmissible a variant is, but the professor says the correct term is fit, which has nothing to do with exercise. It's fit in the evolutionary sense. He says that while there's been a lot of focus on changes in the spike protein, which allow the virus to invade cells, changes can happen in other proteins. And these changes can allow the virus to replicate more easily, evade the immune system, or even allow it to stay longer in nasal passages. As the coronavirus spread through the world, it changed or mutated. Mutations may affect a virus's fitness, which is its ability to reproduce and spread. We should point out here that mutations can also weaken a variant. So far, the Delta variant is the fittest, outcompeting less fit variants by spreading faster than others. Transmission is different from fitness.
Transmission has a very specific meaning to virologists, such as myself. It means the spread of a virus from one person to another person. And it is something that's very hard to measure. And every measurement we do have is always approximation. And here's why. The ability of a virus to transmit is an intrinsic property of the virus, right? Some viruses transmit really poorly, like SARS-CoV-1, and some viruses transmit really well, like SARS-CoV-2. And so that is a fundamental property which is controlled by many different things, like how much the virus reproduces, how stable it is in the droplets, and so forth. But the problem is that the apparent transmission of a virus from one person to another can be hugely influenced by human behavior. If 10 people are in a room with one infected person, all of those 10 people may be infected, but that doesn't change the intrinsic transmissibility of the virus, right? So human behavior is really what drives the spread of a virus through a population. Now, all of the proclamations about transmissibility are made because we see variants suddenly emerging and then dominating and spreading through the population. But that's not necessarily a better transmitting virus. We think it's most of the time because people's behavior has changed. People are getting together again. They don't wear masks. And we know this is happening right now in many parts of the world, and that we have outbreaks, and whatever virus is present, that's the virus that will spread in the outbreak. So transmission is not the right word for that. You know, we have, in virology terms, transmission is the virus itself, but an epidemiologist just views it as the spread of a virus in a population, and that's been the problem.
The professor does want people to take the virus seriously. What he doesn't want to see is misunderstandings creating unnecessary panic. He uses the influenza virus as an example of how fit variants operate.
Every year or two, a new influenza virus variant emerges. It spreads throughout the world, and we have to change the vaccine to accommodate it. If you notice, no one ever calls the new influenza virus variant more transmissible, because it's not. It's simply more fit, and it displaces the previous influenza virus variant. And this is exactly what is happening with alpha, beta, gamma, delta, SARS-CoV-2 variants.
Some countries, such as the US and UK, have started to relax their restrictions on the public, while in China, millions have gone back into lockdown to contain the spread of the Delta variant. In the UK, US and India, the variant accounts for over 90% of new COVID-19 cases. Professor Racaniello says that conclusions about transmissibility are largely based on how widespread a variant is, and not all virologists, including the professor and his colleagues, agree that measurements like this are sufficient to say a variant is more transmissible or contagious. He stresses that human behaviour is just as important as the fitness of any new coronavirus variant.
The same interventions that prevent infection, masking, distancing, and most importantly, vaccination, will prevent infection with these new variants.
In fact, the breakthrough infections we've heard so much about in the media, where vaccinated people have contracted COVID, may not be as concerning as originally thought. Recent data from America shows that while the Delta variant has increased the chances of getting COVID for almost everyone, infection is still uncommon in the vaccinated, a 1 in 5,000 chance per day. And in line with what Professor Racaniello was saying, it's lower still for those who take precautions and live in a vaccinated community. But if the variants continue to spread, aren't we in danger of seeing more variants and more mutations?
As long as the virus can reproduce in people, it will continue to vary, yes. So the solution is to keep the reproduction down by vaccination. And so in places where vaccination levels are low, it's a danger for sure. And there are always pockets of unvaccinated people. And as the virus moves through them, yes, it will continue to sustain changes in its genome that will continue to evade immunity.
While vaccines will prevent moderate to severe illness, the professor points out that they were not tested for their ability to prevent infection, and fully vaccinated people have contracted the virus.
So I'm pretty confident that for at least a couple of years, we're good with the current vaccine. And it's only if the more severe disease level begins to rise, then that may say we need to change the vaccine. And I don't see why people are making a big deal of it, because we do it for influenza virus already. But I suspect it's going to be some years before we have to do that.